afternoon. Well, as we celebrate the day dedicated to our continent and freedom on our continent, there's still hundreds of millions of people in Africa who are vulnerable to COVID-19 because they have not been able to get a vaccination against the coronavirus. You can imagine the impact of all of this after what we've already seen happening in our society around the virus. Chaiban is the Global Lead Coordinator at the COVID-19 Vaccine Delivery Partnership. Ted, good afternoon to you, and I appreciate the time. At this stage, how difficult is it to assess how many people on our continent have already had a vaccine dose? Are we actually able to produce hard numbers on this?
Thank you for having me. We know that 18% of the population in Africa has been fully vaccinated. And then many more have had one dose and need to complete the course of vaccination.
Is the problem that governments are not doing what they are supposed to do? Is it because vaccines are still too expensive? Primarily, they've been manufactured in the West. Some do come from China. Are there other issues which are making it harder for us to vaccinate more people?
So, firstly, when people and governments wanted the vaccine last year, they weren't available, and we need to recognize that. There's been enormous efforts since then to catch up. We now have enough vaccines to vaccinate anyone who needs it. And what we need to do is stay the course. Local manufacturing of health supply is part of the solution. The pandemic has shown us that's part of health security. But it's also important right now to fight this pandemic and to stay the course with vaccination and to increase vaccination levels. The COVID-19 Vaccine Delivery Partnership, which I represent, it's a group put together by UNICEF, WHO, Gavi, and others, is there to support countries, including countries in Africa, to increase vaccination levels, often through campaign-style activities. We've seen that it can be done in a number of countries.
Well, I mean, we saw in countries like the United States and the UK and others, people got vaccinated really very quickly. I mean, more quickly than any other vaccination plan in history in terms of vaccinating adults. It has never happened before. Is the problem also vaccine hesitancy, maybe?
So I think it's a broader issue we need to look at. Omicron changed risk perception. It's a fact. And for a lot of people, they got Omicron. The impact was less than with previous variants of COVID-19. And so they basically said, I have many other priorities to address. But we need to continue to make the case that the pandemic is not over. We've had in the last 4 weeks 14.8 million new cases of COVID-19 globally, and especially for high priority groups, the elderly, healthcare and other frontline workers, people with comorbidities. It's really the only way to protect yourself from death and severe disease, and we don't know what the future holds. So all of us should get vaccinated to avoid the next variant, to avoid severe illness.
You talked about campaign-style activities, and this is, it's quite a big thing to actually go through an entire country and try and vaccinate people, try and encourage people, firstly, to get vaccinated. It goes to capacity of the state, it goes to levels of trust in the state as well. Those are the problems that we're seeing. There's not enough capacity, maybe in some places not enough trust.
So there's no doubt that COVID-19 has come on top of many other pressures on health systems in a number of countries. We were set up to support the countries that were at 10% or less full vaccine coverage in January, 34 countries, the vast majority of which were on the African continent. But we've also seen a number of those countries make progress. Côte d'Ivoire, Uganda, Ethiopia, Chad, and they've done so essentially by mobilizing their health system, by relying on frontline workers, working with community leaders and religious leaders to encourage the population to get vaccinated, and making the vaccine easily accessible. Most adults are willing to get vaccinated if it's something that can be done in an easy manner close to home. And so those are the kind of activities that we're supporting and the kind of strategies that we're promoting. And again, in a number of places, countries that were at 3% vaccine coverage levels in January are now at 20-25% vaccine coverage. So real progress is possible and has been made.
Is there a tipping point to this? Once you get to around 50%, people get more used to the idea. Everyone will have had someone in their family who's been vaccinated. It gets just easier to do it. You're able to do it more quickly.
There is a plateau, and we need to get to that plateau. And indeed, billions of people around the world have received the vaccine. It's safe, and we need to use those experiences to encourage others to come forward. There is a certain amount of vaccine hesitancy. You are correct in the previous question, but really what we want to make the point is about vaccine demand and encourage everyone to get vaccinated because it protects you, it protects your family and the community at large.
There's a lot of other things that are going on all around this. I mean, you talk about capacity, we talk about levels of trust, we talk about whether people will actually go and get the jab. The other issue for the rest of the world, but for people on our continent too, is that if we're not all vaccinated, the risk of more variants coming along is actually quite high.
Very true, and that's a risk for global health. It's also the case that many countries are grappling with many health priorities: malaria, measles, polio, yellow fever. And so what we encourage is integration. Do COVID vaccine and COVID vaccination with other health priorities so that you use and leverage the system to address several requirements at once. Just meeting with the minister from Central African Republic this morning, and that's what they're doing in Central African Republic, a country which has made enormous progress thanks to this strategy.
Ted, thank you very much indeed. Ted Chaiban is the Global Lead Coordinator of the COVID-19 Vaccine Delivery Partnership. I do appreciate the time.